During this video, we'll explain what's involved in cerebral angiography. This is a procedure to check the health of your blood vessels and how blood flows through them. Blood vessels do not show clearly on normal X-rays, so a special dye needs to be injected into your blood first. This highlights the arteries and veins in and around the brain, allowing the doctor to see any problems. To start off, an IV line is usually inserted into a vein, often in the back of your hand. Sedation medicine is usually given through this and will travel via the bloodstream throughout your body to help you relax and feel sleepy. This is not the same as general anesthesia, but you'll feel relaxed. Occasionally, you may need to be put to sleep for the procedure. This is known as general anesthesia. Full details will be provided in your personalized written consent information. You'll lie flat on your back on a special table equipped with a fluoroscope, a rotating X-ray imaging device. A small incision or cut is made over one of your arteries, usually near your groin or wrist. Local anesthesia is used to numb the area where the cut is made. The size and location will vary depending on your personal requirements. A thin, flexible tube known as a catheter is inserted into the artery. You may feel some pushing or pulling when this is done, but it shouldn't be painful. The catheter is carefully guided to the area that's being examined. A dye called a contrast agent is injected into the catheter. You may feel warm, flushed, or nauseous and as though you need to pee for a few seconds after this is done. This dye shows the inside of the blood vessels while a series of X-rays are taken. The fluoroscope will move around your head to record pictures from multiple angles. The doctor will carefully examine the images to make a diagnosis. When the procedure is finished, the catheter will be removed. Pressure will be applied to the groin or wrist to reduce the risk of bleeding. Sometimes this may be done by hand or with a pressure cuff device. You'll be helped onto another bed and may be given an oxygen mask. You'll be moved to the recovery area to rest while the sedation wears off. You'll be asked to lie still for a few hours to prevent bleeding from the cut. You may have a sore groin or wrist for the first few hours or days. However, this will settle with time. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team.